Welcome to the Business of Healthcare, a twice-monthly podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Britt Berrett. Well, we're pleased to start this episode of our podcast, The Business of Healthcare, with a very seasoned and experienced executive, someone I've known for many years and respect immensely. David Toomey is the Senior Vice President with Sharecare, Inc. David, welcome to our podcast.
Thank you, Brett.
Great to have you with us. So we go back a long way, don't we?
We do. It's hard to fathom, actually.
I know, and we're still friends after all that, right?
Exactly.
So, share a little bit of your history and your work with the insurance companies and some of the kind of things you've been working with.
Yeah, so I been in healthcare, now probably going on 32 years. I spent the first 19 years predominantly on the West Coast with Aetna, a big national insurance company. And then lived in Los Angeles for 12 of those 19 years, and then Seattle for 4 of those years. I was responsible for the national accounts segment for about 7 Western states, from Alaska on down through New Mexico. And while I was in Seattle, I did a lot of work with connecting employers with high value delivery systems and facilitating conversations. That was back in 2001 through 2005. And really, really pleased with the efforts of what transpired when you connect the ultimate purchaser with the ultimate supplier.
Right.
Then was recruited to be the regional president for Cigna, moved to Dallas, Texas from the West Coast, and then covered the central part of the country from Chicago on down through Texas. And then while I was there, launched one of the first commercial medical homes in the country, one of the first bundled rates, surgical rates in the country, working with our clinical team and our network team to really advance an entrepreneurial feel to the healthcare industry. And that was very exciting to see the results of those efforts and how it's been replicated in other parts of the world or the country. And then got the itch when healthcare reform came along. It stopped being as exciting in the insurance space. So moved into more of the entrepreneurial world. And I've been there ever since. So last 7 years and the most recent year and a half, 2 years at a company called Sharecare based in Atlanta.
You know, David, you sent shockwaves throughout the industry when you stepped away from the structured healthcare insurance company side and then went into the entrepreneurial side. I was delighted. I was intrigued with that creativity. I've watched you carefully over the years and been inspired with what you've been accomplishing and what you've been working on. I like Sharecare. It seems like a very timely approach to the consumerism tsunami that's hitting the healthcare industry. And I don't think the healthcare industry gets it. So tell us a little bit about Sharecare and what it's all about, what you deliver to the consumer.
Yeah, the ultimate hypothesis, right, is when you think about how the world works today, in the health insurance industry, it's been telephonic and it's been very portal website driven. But when I go to the airport, I don't go to my Uber or Lyft app, right? Or a portal, I go to my Uber or Lyft app, right? And it's very app centric. And it's easy and it's scalable and I know how much it's going to cost and I know the quality rating and all that. But that's non-existent in healthcare today. And so the basic hypothesis when Jeff Arnold and Dr. Oz came together back in 2009 was, how do you create a platform where it helps bring all the different components of healthcare together under one roof and helps an individual, a user, make more informed decisions, right? And bring all the disparate parts of the healthcare equation and make it very, very easy and personal to that individual. Right. And so it's kind of like where Amazon's done so well is to say, you like this book, you really are going to like this book. And to use that artificial intelligence to take advantage of all the technology capabilities within your smartphone and make it easy and relevant for you.
Hi, now, how's Sharecare doing? Successful?
We have been doing extremely well, working with a number of health insurance plans around the country and other Fortune 100 employers around the country. Because the reality is the traditional metrics, traditional programs, traditional service, traditional providers is not enough.
Yeah, I agree.
The average person just doesn't know what to do. If you talk to somebody in my family, they don't think about healthcare on a regular basis. And so we've got to help them. And we've kind of bifurcated the health environment where it's around wellness and then it's healthcare. And I'm a person, right? I need wellness and well-being, but then I need that same resource, platform, or tool to help me make healthcare decisions. And right now we've got to stop the fragmentation and bring it all together.
Well, when I heard about Sharecare and I did a little homework on it, and you came to one of the lectures here on the campus of UTD, I thought, okay, Sharecare, it's Fitbit or Apple Watch on steroids, and that's it. But that's not it at all. It sounds like it's a lot more. It's connectivity, right? It's user-friendly interface with health and wellness, but also accessing providers in a very easy and comfortable way. You use the analogy of Uber, and I think that's an appropriate one. Tell us a little bit about its consumer-friendly approach to accessing healthcare services.
Yeah, the whole premise is I got to create a habit, right? And most people are curious around mortality. And so, Britt, if I asked you what's your chronological age, what your birth age is, you probably know that immediately. But if I ask you your physical age, your real age, most individuals don't know that. So that's one of the assets we acquired early on is a company called The Real Age that's been around since the 90s. And we've had 43 million people take the Real Age test, and it gives you the most accurate predictor of your physical age. And then we're tracking information around you. So that's similar to your Apple Watch, it's tracking your steps, your sleep, your stress levels, all through our platform. Or it can connect into a third-party device or an app. And it also ties into network physicians or a symptom checker called AskMD. And it brings all these different assets together that then say, Britt, I know you. I know what you need because I've learned about you based on everything that's going on with your daily life. And the platform will serve up relevant content specific and unique to your health and healthcare needs.
Are you targeting a specific sector of the consumer base? Is it millennials? Is it veterans? Is it baby boomer? Where are you putting a lot of time and effort?
It's all the above, right? So it's fascinating where people says it's going to be the young person who's going to really use this. But when we look at the data of the 43 million people that have taken the Real Age test, 16% are over age 65. And some astounding number, 40 to 45%, I don't know the exact number, makes under $50,000.
Interesting.
And so from that, we'll be able to connect into your needs and give you capabilities wherever you are in your journey, personally and professionally. And then we'll be announcing some other exciting news in the next couple of weeks regarding different folks that you referenced as well.
It's so true about that portal story and how, I've got a portal with my health insurance company, and honestly, I don't even access it. But if you had something accessible like Sharecare on an app and I could just punch it and I could, find a good physician for a physical or one of those other areas, I love that. But like you said, I can order an Uber van faster than I can sign up for a life-saving procedure or a screening or exam or what have you. Why haven't we done this before? What's been the impediment?
Well, it's hard. I mean, healthcare, as you know, is so complex with physicians and ancillary providers and various efforts. And it takes a significant, we're creating where Steve Jobs was very kind of forward thinking to anticipate what the individual needed before they even asked. And I have an incredible fortune to work with somebody who thinks like that. And he's creating the platform and incorporating artificial intelligence, virtual reality, where you're going to have your own avatar on your own platform, on your app. And so you can see what you look like when you're really stressed out or lack of sleep or have diabetes, and to be able to go inside your body and see the damage you're doing if you don't take your high blood pressure pills. That's
really
amazing to think about the technology that's available today.
I got to quote you on that comment. It's hard. It is hard. It's complicated. It's not easy to orchestrate all these resources and to have a team committed to it. If I'm a consumer, I'm listening to this podcast, I'm saying to myself, okay, so Sharecare will be an app that will access information for me as it relates to my health and wellness, not only monitors my well-being, but perhaps gives me alerts and notifications, but also helps me navigate through the healthcare system, which I would find invaluable. How do I beg for that? How do I access it? I can get the app, but how do I connect that to my insurance company? Or is that a grassroots effort, or how's that to be done?
And so right now we have a two-pronged approach, right? You as an individual can download the consumer platform. And then for health plans or employers, then we bring that connectivity to bear to bring all the different components of that personalized to an individual employee or a member from that vantage point. But as an individual consumer, we're going to give you the basics. And then as you have scale with an employer or a health plan, then we tie in all the dots and cross all those T's for you.
So I go to my HR folks on the campus and I say, hey, there's a Sharecare product. Would you guys just take a look at it? Is that kind of the approach I need to
Absolutely.
To put some,
test drive.
Yeah.
See if you like the Uber app experience or the Lyft app experience, and see if it's relevant to you.
I love hearing what you're up to. I really do. I think you've got profound background and experience and geographic exposure to allow you to be creative. And I'm delighted you're with Sharecare and you're pursuing this because I think it's desperately needed. But let's ask this. What else is on your mind? What other things are you pondering, considering, getting involved with? What's David Toomey thinking about these days?
Yeah, it's kind of what I saw when I was in Seattle working with the employers in Virginia Mason up in the Northwest, right? There's just this amazing chasm of, the ultimate people that pay the bills, i.e. the employers, and the people that provide the services, call the suppliers, the providers, physicians, health systems, whatever you want to call it. And there's a disconnect, right? And I'll give an example personally. So my daughter is an athlete, twisted her ankle. She was the captain of the volleyball team. So quickly went to see an orthopedic specialist, at 4 p.m. And he said, I'll do a favor. I'll call and send over to get your MRI this afternoon just so we can see how bad it is and make sure it's not broken. I was like, oh my gosh, thank you, doc. So I get to the MRI center. It's about 5:30 and they have extended hours till 9, which is great customer service. Really appreciate that. And of course I asked the question in the MRI center and I said, how much is this going to cost? And they looked at me and says, well, you have insurance, don't you? I said, absolutely. How much is it going to cost? And they said, $2,400. And I said,
wow.
Well, that can be done at another place for $415 based on my knowledge of the healthcare industry. And I'm like, yeah, but that's what my insurance company negotiates. So that's what we charge and that's what we get reimbursed. I said, but I'm in a high deductible plan. This is cash out of my pocket. I don't want to pay $2,400 when I can get it done for $413.
Yeah.
So they went back and they came back to say, we'll do it for $400. So the next day we had to follow up to get the MRI read, right? And I went back to the doctor and I was like, why are you bankrupting your patients? And he goes, what do you mean? I said, the Federal Reserve did a study that 60% of the population that got hit with a bill for $450 would be bankrupt. Now I can afford $2,400, but the average person cannot. Why don't you know the cost and the quality of the place you just sent me to? That's not fair to your patients. So please help us. And he goes, I didn't know. And that's the gap that we're trying to close, is to help physicians and doctors know the power of the pen and where they're sending us to, and really embrace Six Sigma, quality, process, cost-effective healthcare to help the patients make really good informed decisions because they don't know what to do.
Well, that pricing transparency is a killer. And I was part of the problem. I was a hospital president for 28 years, as you know. And
yes.
and I had a million excuses why we couldn't give pricing transparency. And the more I step back from the profession, the more I get frustrated because why can't we? We have enough analytics. We have enough data to gather to determine a smooth price, but we refuse to do it because that's not the way we've done it in the past. Consumers are screaming for this, aren't they?
They are. And the reality is, as healthcare costs continue to increase, right, the financial stress people are under with making ends meet, right? And so now they think about healthcare costs continue to escalate, more pressure on the individual, less knowledge about what to do. And the reality is, back to that chasm, the disconnect between what that user needs to ask for, that patient, that employee, that family member, And then how do you connect them in with the right physician that's high quality, that cares, that wants to do a good job, and then embraces Six Sigma healthcare? That's how you get the 30% waste out of the healthcare system.
So you jumped ahead because I at a first step, I just like to see transparency. I got to tell you a funny story. So I have a couple undergraduate classes in healthcare management. So here at the University of Texas at Dallas, we have a healthcare management undergraduate and a graduate degree. And we have a physician master's degree as well, which has got like a 2-year waiting list. It's been spectacular. But I assigned my undergraduate students to contact 3 different healthcare organizations outside the Dallas-Fort Worth area and ask for a price for a hip replacement. And oh my, it was hilarious because I got a series of emails saying, Dr. Berrett, they won't give me the numbers. What am I supposed to do? And my response is, keep calling.
Absolutely.
And then when they finally concluded, so this was about 120 students that completed the assignment, I would venture to say they had 70% of those organizations that they contacted refused to give them a price or couldn't or got transferred. And then when we finally got pricing, the range was from $35,000 to $120,000 for a hip replacement. And one very creative kid contacted International and said, I could hire a private jet, fly my entire family to this international location, have a hip replacement, and recover on the beaches with a Mai Tai, and then fly back and still be at a quarter of the price that I otherwise would have had in the United States. We've got a problem if we've got that lack of transparency and that the scope of from 35 to 120,000. That's a problem. Are you seeing that around? Is that a common experience?
Absolutely,
you're seeing?
Right. And so, and the big question, like I said, I've been in healthcare like you a long time. We're not that old though, but it's just that what's going to get it to change, right? And from my viewpoint, it's the person that pays the bills, the employers,
right,
until they say we're done. And I'm going to channel my patients, my employees, my members to those providers that are transparent, focused on quality, and focused on Six Sigma, or else you're not going to get my business. And that's some of the work that we're doing with the Dallas-Fort Worth Business Group on health, me personally, not through Sharecare.
So you're going to look at, you mentioned Lean and Six Sigma. You're going to look at processes and systems within the delivery function. Yeah. We pretty much generate a fee-for-service bill and then accept what the discounted rate is, and then that's as far as we go. But that's ineffective when we talk about large population groups and redirecting business because of the value out proposition or value-based purchasing.
Absolutely. So as an example, we're working with a specialty group that focuses on back pain because there's uncomplicated low back pain has significant variation in process of care. So with a very well-regarded system, specialty practice in town, when we started asking questions as to their process of care, we asked them how many physical therapists they work with. They refer to 300 plus physical therapy offices.
Wow.
And my first question is, why? And they're like, that's just what happens. And so, and then how do you make sure there's consistency and how many imaging places do you refer to? And they started questioning process and questioning process redesign and questioning referral management process. And they, all of a sudden the light bulbs came on to say, wow, we're part of the problem. I was like, yeah, we need your help. Help us solve the issues. Because how many times do you hear about somebody has an unnecessary back pain and that person's going through absolute hell and spending $40,000, $50,000, $100,000 just because with no clinical efficacy that it solved the problem.
Well, there's also a business case for anyone that's listening to support this effort. But if you're one of those 300 physical therapy clinics and 20 of them decide we're going to become much more efficient, effective, and pricing transparent, the rest of them will be left out in the cold. The ones who sit around doing the same old are toast. So it behooves them to jump in this and embrace a more systemic approach to the delivery of their care and their pricing transparency. I think that'll be fascinating. I think it'll be fascinating to see how disruptive this innovative approach is to the market because they've been fighting it for decades, haven't they?
Exactly.
I mean, they've just been fighting it.
And it's called market competition, right? That's how flat screen TVs went from $5,000 down to $300 or $400, right? And it's better quality, better service, better, experience overall. We've seen that with LASIK surgery. Wherever there's a price for the consumer that they have to compete, then it's all about making sure that you remove that non-value added waste. When the bill is hidden from the ultimate consumer, the patient, the employee, the member, that's when it gets complicated.
What should we be doing? If someone's listening to this broadcast, they share your same angst regarding pricing transparency. What are your thoughts? How can they become involved or engaged in the effort to really illuminate this issue in a larger way? What do you think?
Yeah, I'd say a couple of ways, right? First off, act like a consumer. You're the customer when you go to a physician's office. Right?
Good.
If you go to a physician's office and your appointment's at 9:00, expect to be seen at 9:00, not 10:00. Ask questions up front are you going to be late? Tell me if you're going to be late. Respect my time as much as I respect your time. And tell me how much you're going to cost for that procedure before it's done. And put pressure on the system that you're asking the right thoughtful questions. Secondarily, if you work for a company, an employer, be involved in the Dallas-Fort Worth Business Group on Health on the IQ8C Quality Initiative, where it's really getting employers to embrace Six Sigma around healthcare, focused on starting out low back pain that will expand to other conditions, and really get your employer to leverage their scale to help bring this change to bear in the marketplace.
So that's the Dallas-Fort Worth. Tell us again what that is.
The Dallas-Fort Worth Business Group on Health. It's the employer coalition in town that's been around for a number of years, 35 years. And it's the IQ8C initiative, Integrated Quality Healthcare Initiative.
I purposefully want to call that out because I know it's a great organization and have done some phenomenal things as it relates to the needs in our community. And they've got a great website as well to access. So if individuals are listening to this podcast and don't want to sit on their duffs, they want to get involved with this, there's a place for you to go.
Absolutely. Do something. We have a wave of consumerism, and we have a tremendous $3 trillion. Actually, that's probably going to be $4 trillion by the time, exactly.
And I don't see it slowing down at all, other than these efforts, such as yours, that will hold the healthcare providers accountable and responsible. And I think we owe it to them. We absolutely owe it to them. So, David, always a pleasure. Any final thoughts before we close today's podcast?
No, excited to be here. I'm glad y'all are talking about the business of healthcare. It's much needed in our country. It's much needed in our community. And really looking forward to see people more engaged and driving for change to help solve a huge economic burden that's straddling our country. So thank you.
David Toomey, Vice President with Sharecare, Inc. I'm Dr. Britt Berrett with the Center for Healthcare Leadership and Management at the University of Texas at Dallas, and delighted to have David with us, delighted to have this engaging conversation, and encourage our listeners to participate. To that end, if you need any further information, sharecare.com is a great place for you to go. David, thanks again, and have a great, great day.
Thanks, Britt.
Thanks for joining us here on the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episodes, notes, links, and more. And be sure to subscribe to the Business of Healthcare podcast on iTunes or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Centers and Institutes tab on the navigation menu. I'm Dr. Britt Berrett, Director of the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.